Hey guys, this is Side Dental Vlogs, and today I'm going to make a video about how to manage a case in which when extraction or while placing implant we have injured the nerve, mandibular nerve, or some amount of pinching injury to the nerve. How to manage that case. So why this happens actually? So first of all, before doing any extraction case or surgical case, we don't know what is the quality of the bone. We can only see the position of the tooth in respect to the mandibular canal and mandibular nerve by either taking a CBCT, or we can also take a IOPA. So the pre-assessment of any case is very important before doing any kind of extraction or while placing the implant. For placing the implant also, CBCT is must. So I'm not telling that for every case of doing impaction you do CBCT, but at least for before placing implant we can tell the patient to take a CBCT, so we can know the correlation between the nerve and where you are going to place the implant. But still, after taking so many precautions, we don't want to injure or we don't want to harm the patient, right? So what happens is, while extraction, sometimes it becomes difficult during the process of removing a tooth, and sometimes we may injure the nerve. Similarly, while placing the implant, sometimes what happens, the initial beginning of placing the implant, the initial cortical bone will be soft, but as we go deeper towards the nerve or 1 mm proximal to the nerve, so sometimes our burr may hit the nerve and cause little bit of neuropraxia. Neuropraxia means little bit of injury to the mandibular nerve. So patient comes to you another day with paresthesia. I also had a similar kind of patient. Mandible where the injury happened will go into paresthesia. Suppose you are placing an implant in the premolar area, very common in that area. So sometimes we impinge the mandibular nerve there. So there will be paresthesia in the lower lip one side, and this area will be little bit anesthetized. The anesthesia patient will usually say that the anesthesia has not gone till now what you had given. So that means there is a nerve injury, and whenever you touch this area, the sensory feeling will be gone. So what are the medications we give in these kind of cases? So first of all, I give chimeral fort. It's a combination of chymotrypsin and trypsin, so that in order to reduce the swelling and inflammation in and around the nerve. This is very important. Apart from antibiotic and painkillers, I'm telling that too, you are giving for maximum 5 to 7 days. So this chimeral forte helps to reduce the inflammation 3 times a day for 10 days. Then after that, I add methylcobalamin supplement. Along with this, I also write pre-GABA M75 to the patient. What does it do actually? The pre-GABA M75 relaxes the nerve endings and it heals the nerve. So a minimum of 3 months is required to get any kind of response from the patient, right? It's not like you gave medications for 10 days and the pain will be gone, right? So you have to give one medicine which is known as Neurobind Fort for 3 months and wait until and unless. So usually it takes around 4 to 5 months for the entire sensation to come back. Usually that what happened in my case. Differs from patient to patient, whether the patient is diabetic or any other medical system problems is there in the patient or not. So this is what I do. We have to assure the patient, right, this is gonna be correct. Okay, so another thing which we have tried in our hospital is we have also tried laser treatment in the paresthetic area, modulation therapy which we give over the area where the nerve injuries happen. So that also heals the nerve very fast. So this is all with today's video. I hope you like this video. Please do share it, subscribe, and you can see my Instagram channel as well. The name of the Instagram channel is sai_dental. Till then, take care. Bye bye. Love you all.